It is considered that we can get the daily required amount of vitamin D naturally from diet and by synthesizing it in the skin under direct sunlight. But for some groups of people, this is hard or even impossible.
Darker skin people. The darker the skin, the less vitamin D it can synthesize. That's because melanin, the pigment responsible for skin color, blocks vitamin D production.
Elderly. Skin makes less vitamin D with age. Also, older adults tend to go outside less.
Indoor workers. Office life is high deficiency risk, as no sun equals to no natural vitamin D.
Overweight individuals. Vitamin D gets trapped in fat cells, making less available for the body.
People whose diet does not include vitamin D-rich foods. We have published a full list of foods highest in vitamin D. Just take a look. The link is in the description and pinned comment.
People with gut issues such as irritable bowel syndrome, Crohn's, celiac diseases. Their bodies absorb less vitamin D from food.
People with liver and kidney disease. These organs convert vitamin D into its active form. If they don't function well, vitamin D stays inactive.
If you belong to any of the risk groups listed above, check if you have symptoms of vitamin D deficiency. The link for complete list of symptoms is in the description.
So how much vitamin D do you need daily?
First of all, if you suspect a vitamin D deficiency, we highly recommend visiting a family doctor and taking a blood test. But if this is unavailable to you right now, do not take more than 1,000 international units daily or 7,000 weekly, regardless of the time of year.
Take it preferably with fatty foods for better absorption.
Do not overdose. Too much vitamin D from supplements can lead to toxicity.
Signs and symptoms of excess vitamin D include nausea, vomiting, decreased appetite, constipation, increased thirst, frequent urination, dehydration, fatigue, muscle weakness, bone pain, lethargy, confusion, and kidney stones.
So, if you still have doubts and there is no doctor nearby, message the supervisor of this project on Facebook or Instagram. Dr. Benny has helped thousands of people in need over the past 17 years. The links are also in the description.
What about young, healthy people with very fair skin who spend time outdoors regularly?
They most likely do not have a vitamin D deficiency, although exceptions are always possible. In any case, we do not recommend taking even a minimal preventive dose without a blood test. The same symptoms that occur with vitamin D deficiency can be caused by many other health issues.
And it is these topics that we will talk about in our upcoming videos. So subscribe and press the bell icon not to miss updates.
Thank you for watching.